Dr. Profeta, I understand that you've had your second dose of the vaccine. How's that gone for you?
Well, yesterday when I got it, I got about 9 o'clock in the morning. I started feeling weak and bad headache by later on in the evening, about 8 or 9 at night. And got up early this morning, did an interview, had still a bad headache and body aches, but then through the morning had high fevers, chills, and really just felt awful. I finally had to call in and have somebody come in to cover for me. So thank God I got great partners that stepped in and covered my shift today. But now I feel fine.
So how long would you say that your body had this reaction?
It probably started at hour 10 after getting the shot and lasted up to about 30 hours total after the shot. And I'm on a doctor's social media site with about 22,000 ER colleagues, and pretty much everybody's saying the same thing. Everybody's having some degree of reaction. They're ranging from real bad, pain around the injection site to really high fevers and chills and horrible headache. Headache and body ache and fever and chills tend to be the it seems like overwhelming side effect, but everybody's in good spirits about it, believe it or not. So it's no big deal.
When news of side effects like this get out from the second dose, do you worry that that means that people won't want to go back and get that second dose?
Oh, absolutely. But they shouldn't. Those side effects are a way of showing you that you're probably mounting an immune response and it works. And that should actually, in a sort of odd way, make you feel a little bit better about what you have going on. So, we're all, like I said, all the ER docs sort of joke about it. Everybody's talking about, hey, what are you taking? Chicken soup or Tylenol or Advil or what have you. But, we're all in fairly good spirits about it. None of us are worried about the side effects.
And tell me again, what were the symptoms that you had that kind of came on at around hour 10?
It started with a headache. And it was an odd headache, really not like your typical tension or stress headache or even fever headache. And it just got progressively worse. And then whole body aches, and you could just tell your muscles and your joints and, started to hurt, and then just, had a fever associated with it, but then it broke, and now, fine. I feel great. I mean, I could go into work, I could go do whatever. And pretty much everybody's saying the same thing. It lasts for about 24 to 30 hours total after getting the vaccine, and then everything goes away and you just feel fine. So, I'm okay now.
Well, and so what is getting this news out to people? What is it that you want them to learn? Is it that to not be so cavalier about the timing of when you take the second one as opposed to not taking the vaccine?
Yeah, I think the take-home message, number one, is you got to get vaccinated. Everybody has to get vaccinated for this. When it comes to the second vaccine, if I were doing a job like mine, or if you had something where you absolutely had to be somewhere the next day, I think it might be prudent not to do what I did. Make sure you have a day off after getting the shot. Don't anticipate you're going to be able to go to work that evening or the next day. So, if you have those kind of jobs, try to do it on your day off or space it out a little bit. That would be my take-home message.
And what does it mean when your body reacts like that? Does that mean that the vaccine's working, that it's, when you take a vaccine and then your body has a response, what does that signal?
Well, you can sort of think about it in terms of an immune response. Your body is sort of releasing modulators of immunity, and some of those modulators can cause, inflammation and fever and body aches, and that's what you're sort of getting. You're getting sort of almost like a serum sickness kind of reaction, where the immune system gets sort of really primed and it's releasing heat and energy, and it doesn't feel too good. But, so what? It's better than getting COVID-19. So I'll take that any day.
I think, and you've seen what happens when people get COVID-19, right?
Yeah, unfortunately. Yeah. All too much.
How are things in the emergency room these days?
They're rough. They're rough. We got a lot of very sick people, and it's not just from COVID. It's from all the other illnesses that they've been allowed to sort of go unchecked, from cancer to heart failure to strokes to blood clots. And then there's a lot of other illnesses associated with COVID-19 too. And, we're going to get through it, but man, it is a haul. All the healthcare workers in the state and across the country have done just an incredibly admirable job. They've been heroic in their response. So, we're doing okay.
you could have a microphone and talk to the people of Central Indiana, what's your message to them?
Stay positive. Okay. We're going to get through it. We're moving in the right direction. It's still going to take a concerted effort. It's still going to take some personal responsibility. We have to help out our elderly family members and friends too, and keep wearing the mask, keep social distancing, keep hand hygiene, get vaccinated. And, in time, this is all going to swing the way we want to, but we still have work to do, but we're going to get through this. We're going to get through this.
Do you think it's important that we report to people that they will most likely have a side effect from taking the vaccine?
I think that you should anticipate that your second vaccine, you're probably going to have some sort of, if we're still doing 2 vaccines, science changes, but I anticipate it's still going to be a 2-shot regimen. I think that you can anticipate having some sort of viral almost kind of reaction after that second vaccine. It doesn't mean that you have COVID and you got to come running into the hospital. The lay people need to know that the vaccine they're getting is not like live COVID vaccine. So, you may have fevers, you may have body aches, but it's really nothing to be worried about. Drink some fluids, eat some soup, take some Tylenol and ibuprofen. You're going to be fine. You're going to get through it.
I was reading an article where it said it's important to realize, like, in the most simplified terms, that the vaccine is kind of coming in your body and telling it, we want you to kind of change the way that you react to this angry protein if you ever were to encounter it. And so it does take, there are symptoms of your body reprogramming what it's going to do. Do you find that's an oversimplification?
No, I think that's actually sort of accurate. I mean, we're getting the body to produce cells or antibodies that can recognize the surface protein, the spike protein on the coronavirus. So you're sort of tricking your body into, almost sending out an all points bulletin. This is what we're looking for. You're giving your body sort of a mug shot of what the coronavirus looks like. And so then when the real virus enters your system, there's sort of millions and millions of sentry cells that are looking for that virus now. Whereas before, you didn't have any of those, but now they're all ready and they're all ready to pounce and they're going to come at it, full steam. And that's sort of what you're getting when you get that second vaccine. They're all primed, they're all ready to go to war. And then they give you that second vaccine. They go, oh, here we are. But it's really not the coronavirus. It's still the second vaccine, but that's what you're doing. You're sort of priming the pump and you're getting the body ready for warfare, sort of germ warfare, viral warfare, as we should say.
And so it would make sense that you would develop a fever, or that your body would feel a little bit different as your body's getting geared up for war.
Yeah, absolutely. It's sort of your body's way of saying, oops, my bad. I thought there was real coronavirus. And it's a good thing. It's like a prep for the real thing. And so it gives you sort of comfort to know that your body's getting primed to attack real virus should that opportunity have to come up. So.
Yeah. And you took the Pfizer vaccine.
Yeah.
Yeah. Is there anything else you want to say, doctor, before we wrap up?
No, just like keep the course, keep steady. There's a lot of good out there. There's a lot of positive things. We tend to get bogged down a lot in social media and the news and everything like that, but there's a lot of good stuff out there. Take stock of your blessings, keep moving forward, and we're going to be okay.